For presentation 2, we will present safety and health. Meet our team: Alif Hafizi, Ahmad Fahim, me, Sarah Ariana, Amir Aiman, and Irfan Shamil.
So we go to the objective. So for the first objective is promote safe and healthful workplace. So the primary goal of the Occupational Safety and Health Act is to ensure that employers provide workplace free from recognized hazard that could cause serious harm or death to the workers. Second, provide training and education. Occupational Safety and Health Act, or short form is OSH, aims to educate employers and workers about safety and health issue in the workplace. This include providing training program, outreach, and educational material to enhance awareness and understanding about safety and health. Last but not least, which is encourage employer and employee responsibility. So the OSH Act encourage a partnership between employers and employees to create and maintain a safe working environment. Employers have a responsibility to provide a safe workplace, and employees also have the right to have a safe and healthful work environment.
Introduction is the Occupational Safety and Health Act is a law passed by the US Congress in 1970 to ensure safe workplace conditions around the country. It established the Federal Occupational Safety and Health Administration (OSHA), which sets and enforces workplace health and safety standards. OSHA serves as the enforcement arm of the Act, applying fines and penalties to employers that violate its rules, standards, and guidelines.
Assalamualaikum warahmatullahi wabarakatuh, and today I will continue with procedures for employers, OSHA, and notification of diseases during the COVID-19 pandemic. So we first start with the employers. So number one is to encourage and facilitate employees to get the COVID-19 vaccination under the national COVID-19 immunization programs. So the second is to communicate regularly to employees about COVID-19, so we can help advise employees on preventative methods when it's necessary. Physical distancing, keep 1 meter away from others, practicing personal hygiene and respiratory etiquette, practicing hand hygiene, use a mask in areas, using a mask in areas where required and where this is taken up be maintained. We also need to remind employees regularly about preventative methods by using emails or social media. We can also provide regular updates on COVID-19 to employees. Next is to provide appropriate health education and promotion materials regarding COVID-19 to all employees. You can use the employee's native language if needed. So next one is to identify vulnerable employers and ensure extra precaution is taken in a way to control chronic disease, strict controls measures at the workplace. Next one is to instruct supervisors to monitor. One is for the system among the employees at workplace and employee compliance to preventive measures, and also encourage the employees to monitor for systems. So what happens when an employee develops systems at the workplace? So the supervisor need to isolate the staff member from the work area, ensure that the affected employees was the employee with the symptoms wear face mask and seeks medical attention at the nearest health facility immediately. Ensure the incoming person also wears a face mask. So next one is to conduct mental health assessments among employees and carry out appropriate measures to reduce stress among employees. The next one is to monitor sick leave and absenteeism among employees. We need to keep a record of sick leave, including reasons for leave, durations of leave, and current status of the employee. We move on into employees. So number one is to keep updated on COVID-19. The second is to get recommended a booster dose based on the current requirement. Third is always maintain a good personal hygiene, frequent hand washing with soap and water or hand sanitizer, practice cough and sneezing etiquette. Fourth, to practice physical distancing at work during breaks and meals. Fifth, if employees develop symptoms, number one, for example, at the workplace, then you need to alert the supervisor immediately. Wear a face mask, avoid contact with other fellow employees, and seek medical treatment if you are immediately ill. If you are at home, wear a face mask and seek medical attention at the nearest health facility immediately. You need to avoid contacts with family members, and accompanying persons should also wear a face mask. Employees are advised to practice all protective measures out of works. And the last one is to maintain health status at an optimal level, especially for those with chronic diseases. Next, we move on into OSHA, or the health and safety organizations, usually hospitals, non-government and governmental, or even the Ministry of Health. So, during COVID-19, it follows the 9 pillars of encompassing public areas, centers to prepare preparation and response activities, which is the first pillar, which is country level coordination, planning and monitoring. Pillar 2 is risk. Pillar 2 is risk communication and community engagement. Pillar 3 is surveillance, rapid response team and case investigation. Pillar 4, points of entries, international travel and transport. Pillar 5, national laboratories. Pillar 6, infection prevention and control. Pillar 7 is case management. Pillar 8, operational support and logistics. And the last one is to maintaining its essential health service and system. Next is the government implementation of a nationwide cordon sanitaire. What does cordon sanitaire means is that it's the closing of public or community borders or erection of a barrier around a geographic area with strict enforcement to prevent movement into or out of the area. Usually in our case, the government call it the Movement Control or the MCO. Next, a Central Coordination Council has been created for COVID-19. This is our National Security Council that helps contribute to research, capacity, surveillance activities, and delivery of medical services such as COVID-19 related physical and digital infrastructures. A lot of government and non-government organizations came under the umbrella of the National Security Council so that they can help organize these organizations for what their roles during the COVID-19 pandemic back then and still is. The next one is adopted a targeted screening approach for case detection and monitoring. So all individuals that are identified as high risk, such as incoming travelers and individuals from EMCO and MCO areas, usually like the higher risk area, were screened and sampled if they fulfill the suspected case definition. So the case detection capacity of targeted screening was enhanced with the involvement of multiple agencies in the process, such as the police, the customs of Malaysia, even the military. So these people can help and essentially identify people that are high risk. So thank you, madam, for listening. I will continue with my other equipment. Let's move on into hospital and non-hospital quarantine system that were designated to manage COVID-19 cases, usually according to degree of disease severity and risk of infection. This is so that all of the medical facilities and resources can be properly channeled. We don't want like the higher case of the higher case areas, usually that have like the medical system in the area is not adequate for high risk, whereas the low risk area has like many medical equipment. We need to have a good the government need to have a good organization of where to put where, so that all people can be treated. Next is by using the Prevention and Control Infectious Disease Act of 1988, the authority can declare an infected area and implement IPC measures such as a lockdown. This is so and government have full authority so that to prohibit any spread of diseases if one area got affected. And for the last one is the notification to prevent COVID-19. So number one is by usually notify the nearest district health office if there's a case nearby, or if even someone just got a symptom, then you need to go to a DHO to get testing and immediate treatment. Next is by using social media such as TikTok, Facebook, Twitter for news and status of COVID-19 that we can know where. And then the last one is you can use it to provide government apps such as MySuggestor for news and status. It can also help notify the DHO for suspected cases, as the MySuggestor is also a very useful tool, very useful app, to control, to even help to identify someone that basically got screened.
So now I will talk about the case study of sustainability issues for compressor industry. So firstly, increased demand for economical. Since the compressed air demand is increased, so they need a sustainable compressed air generation to power machinery and tools across a wide variety of industry. Secondly, compete in both the local and international market. Growth of the new industries sees the need of existing manufacturers to upgrade their equipment to the new world standard in order to compete in both the local and international market. Next, the energy costs increasing frequently. With the energy costs rising constantly, compressed air reliant industries need to lower the cost of their energy while maintaining or increasing compressed air power output. So lastly, peak operating efficiency. To ensure these energy saving measures are maintained at a peak operating efficiency, so they need a trained support and service teams.
So now I'm going to explain the problem solving and actions taken during the case study. Solution number one is mobilizing leadership teams to enable agility to make better decisions. In this time, higher authorities of each brand of the restaurant discusses the schedule of the employees, the decision of importance for each section. For example, they need to decide the amount of people that is working for each section to ensure a safe environment. This is to ensure they are able to operate smoothly during critical times, but also maintaining a safe distance and a safe environment for the workers. It is very practical for them to do this and efficient to avoid a total lockdown because they cannot operate properly while maintaining a safe environment. They are able to reduce and tackle the spread of COVID-19 while still thriving in business. Moving on to the second solution. Using data and feedback to build trust and confidence in operating restaurants and also offices. Firstly, the restaurant or the company build engagement with customers by having a feedback session. They take action with future consideration based on customers' feedback on how they want to operate how they want to operate during the COVID-19 period, and also they consider feedbacks from the employees of how they want to work and how a work environment that they desire. And for offices, the usage of open concept space ensures employees feel safe working. By doing this, company can still operate safely while also considering the safety of the customers and also employee. This will ensure a good business because the customers and employees are happy and confident to be dining and working in the restaurant. Solution number 3 is accelerating employee support pre and post pandemic. By this solution, the company needs to re-examine corporate workforce post-pandemic and also post-pandemic and pre-pandemic. This is because the situation is almost similar, only for it to differ from pandemic to endemic. So they have to reorganize employee schedule to ensure that they are working in a safe environment for the shop operation and also online operation. In this period of time, they did engage in online operations such as GrabFood and Foodpanda to ensure that the business is still running smoothly, although reducing the customers that is dining in the restaurant. Based on the case study, the general supports around health and wellness was the key at McDonald's. Smooth operation by considering the safety and the confidence of the customers and also workers. They ensure a smooth business. Can be run even during the pandemic and also post-pandemic.
The conclusion is the OSHA prioritizes workplace safety by preventing hazards. OSHA provides education through training programs, fostering awareness among employers and employees, encouraging collaboration. The Act creates a partnership for a safe workplace. Employers are responsible for safety and employees have the right to a healthy environment. This collective effort emphasizes shared responsibility, ensuring commitment to maintaining a safe and healthy workplace.